So I will introduce myself. I am Diane Gross. I'm the program director at SLE Lupus Foundation, Lupus Research Institute, and part of what I do in addition to, organizing events like this, as I said, is advocacy. So we're going to just talk a little bit today about what advocacy is, what the LRI and its national coalition members do, and talk a bit about what it is that you can do. But why is advocacy so important, and why are we talking about it at a research meeting? Well, you heard about some, potential for some exciting new treatments today, right? Okay, good. We got some activity in the audience. So you're going to want access to these medications when they come on the market. So we need advocacy. We need to make sure that people have access to the treatments and services that they need. So advocacy, you can Google it and find a ton of different definitions, but they're pretty much all the same. I like this one, the act of pleading for, supporting, or recommending a cause or course of action. The important thing being action. You have to take action. So different kinds of advocacy. There is individual advocacy. So, you have a very specific problem, very specific to you. You work to fix it. But then there's grassroots advocacy, which is basically what the LRI does. And it's getting our members together to work to contact elected officials, educate them on lupus and on issues that are important to us. And so there's a group of folks, I think that's a photo from Washington, D.C. So why this beautiful stream? So I'm going to ask you to use your imagination for a minute and think about this in a little bit of a different way. So imagine, you're standing by this beautiful stream. There's two people, and trash starts flowing down. So one person goes wading in and is pulling out the trash. And the other person starts walking away and heading upstream. And the first person says, where are you going? Why aren't you helping me pull out the trash? And so the person who's walking upstream says, because I'm going to go upstream and find the source of the trash and stop it. And that going upstream is what we try to do. That working downstream is when you're trying to solve that specific problem that you have, like maybe your doctor prescribed a drug for you and your insurance company doesn't want to cover it, or they made a referral and you have to fight with your insurance company or in order to get it covered. So going upstream is kind of what I want to talk a little bit more about today. Like, what can you do? So how many of you have ever had to self-advocate to get something fixed? So not as many hands up as I thought. Okay, that's pretty good. So how many of you have ever advocated upstream, whether, healthcare, environment, just anything that's important to you? And there are some hands I know that should be going up that aren't, but that's okay. Thank you. And healthcare-related advocacy, very specifically, fewer hands, okay. And I'm sure that I know that lupus-specific advocacy would be even fewer hands. So, we've got a range of people in the room, from people who have made advocacy kind of their life's work, people who have traveled to Washington or Albany, to talk to their representatives, people who have reached out to their representatives when we've done a call to action. So really, you can do however much you choose. And that's, one of the nice things about advocacy. You can do what you're comfortable with. So I want to talk a little bit about what the advocacy priorities are at the LRI. Investment in biomedical research, expanded healthcare access, which includes access to treatments and medication, and elimination of disparities in lupus to reduce barriers to care. So I'm going to start with the last issue first, because this is a great success story, but, you know, like many things, it takes a lot of patience and perseverance. So our Lupus Research Institute National Coalition is a group of independent lupus organizations across the country, and they have worked very hard in Washington to secure over $6 million from the U.S. Congress to support a federal initiative called the Lupus Initiative. So, you know, many of you in here, I'm sure, know all too well, it can take many years and many doctor visits to get properly diagnosed with lupus. And, you know, the outlook is better when you're diagnosed sooner and you can get into treatment. So in raising this money for this program is about educating primary care doctors and medical students in the diagnosis of lupus. So this turned into a grant-funded program from the Office of Minority Health to the American College of Rheumatology. And it all started because Peggy Dowd went to Washington to meet with the then head of the Office of Minority Health to talk to him about getting some help for the Lupus Cooperative of New York program that we have, to get some help in Brooklyn. And he basically said, no, we need to do something bigger. We need to educate physicians. So it took, you know, many years and lots of talking to lots of people, but there has been close to $7 million put into this project, and it is moving along very rapidly. There's one more year of funding, and we are educating those doctors in the community who are most likely to see lupus patients and making sure that they know about lupus and think about lupus. So hopefully this will have an impact and people will be getting diagnosed and into treatment faster, and that 4 to 5 years that we hear from a lot of people will be reduced. So the next thing I want to talk about is biomedical research funding. And you may think, well, you know, what can I do to help get research funding? So there's a lot you can do. When we have a call to action, because the budget for the National Institutes of Health, or the NIH, which you've heard a lot about, is threatened, you know, you can help reach out to your legislators and let them know why this science is so important. So what I'm just showing you here is from the Lupus Research Institute website. And if you go to the Advocacy tab, there's a Legislative Action Center. So if you want to know what kinds of issues we are working on, that's the place to go. And there's a few different items there. And so the first one there is about funding for the NIH. And we try and make this as easy as possible for you. So you can just put in your information and shoot an email off to your representative. You can get information to make a phone call. But reaching out and letting your voice be heard is very important. So last March, we had our very first virtual advocacy day. And we had a few hundred people from across the country respond, and we reached representatives in 33 states. So I thought that was pretty good for a first shot out. So again, you know, you don't have to travel to Washington or Albany. We try and, you know, give you the information you need so that you can do some outreach. So I think it was pretty clear from, you know, what you heard earlier about why NIH funding is so important. it really is the major source of biomedical research funding in the country and, possibly even globally. And, the LRI can only, fund so much. And as you heard, we really focus on small grants for novel research that help get the investigators started so that they can then go to the NIH. And I think Dr. Thurman talked a little bit about that. So, okay, so this was another a project that was nanoparticles, and it would be delivering targeted drug treatment, which we heard a little bit about today. So if the treatment is targeted to those specific cells, then we would eliminate some side effects, which would be wonderful. And some other breakthroughs in anemia, heart disease, and these all take time and require a lot of money, as you had seen on Dr. Grammer's slide. If you can see from what was her, it was well over, I think, 17 years and over $1 billion. So it's important that we have these funds. So I'm going to move a little bit to talk about access to care and treatment, and talk a little bit about specifically what's kind of happening here in New York State. So as many of you know all too well, having health insurance doesn't necessarily mean you're going to get the medicines and the care that you need. You might have a health insurance plan that has a limited network, and there's a specialist you need to see. And, so it's going to cost you a lot of money out of pocket. Your doctor may want to put you on a different medicine, but your insurance company may step in and say, no, we're not going to approve this right now. We want to see the patient on something less costly. And, they want to put you back on prednisone, and you work so hard to wean off of it. And you really have no recourse right now except to self-advocate and hope that you can win your case and get the prescription that your doctor wants to put you on. But there has been a bill in the state legislature for quite a few years, and every year it gets tweaked a little bit and a little bit. And Amory referred to Kathleen a few times. So Kathleen Arnson here, who works tirelessly on these advocacy issues, has worked very hard on trying to get this bill passed. And in the last legislative session, it once again did not pass, but we're not going to give up. This would give physicians an override process so that the decision is being made by you and your physician, as opposed to your insurance company. So hopefully, when we put out a call to action when the New York State Legislature is back in session again, you will all say, I'm going to get involved in that and see what I can do to help get this passed, so that next year nobody has to stand here talking about that again, except to say that it was successful. Because for those of you that were at this meeting last year, I know this is one of the topics that Kathleen had talked about. So I'm going to step back a minute and just tell you a little story. So I actually started out my career as a customer service rep for an HMO. And so I was that person on the other end of the phone that you would be calling, explaining your situation and trying to get help and get answers. And, there were days when, you could help people out easily, and there were days when, it could be pretty tough and kind of depressing. But I'll never forget this one time where I thought I had the easy answer. This gentleman calls, and he took a prescription to the pharmacist for his teenage daughter for acne. And it was rejected at the pharmacy. And it's because a lot of people were using that drug, that cream, for wrinkles. And cosmetics are not, cosmetic reasons are not covered by your insurance. So, of course, it was rejected. So he calls and explains all this. And I said, well, no problem. It's for acne. And, here I am barely out of the teenage years myself, can totally sympathize, with that. And, just send the prescription in and, we'll reimburse you. You think, okay, easy answer. So the gentleman said to me, and I will tell you, these words have stuck with me literally 25 years. He said, "You are the object of my frustration." And I'm thinking, but I'm trying to help. So how do we get all these objects of our frustration out of the way so that everyone can have access for the care that they need? So unfortunately, it's piecemeal legislation like this that we all have to let our voices be heard. And it's our right to do that. So this is just one of the, issues that we have been working on very hard. And again, where patience and perseverance, hopefully, is going to pay off. So another issue with medication access are specialty drug tiers. So certain medications are put on this high copayment tier. So, if it's 25%, say a drug costs $1,000, that's a $250 copayment. And even if the drug costs $250, at 25%, that's $6,250, which for some people is not affordable, and the decision has to be made in how to pay for that. So legislation was introduced at the federal level called HR 460, which would prevent commercial insurers from doing this. So in New York State, you're probably sitting there thinking, I haven't had that problem. That's because in New York State, we actually do have a bill that prevents this, and one of very few that do. Wouldn't it be nice, though, if we had federal legislation so it wasn't 50 different rules in 50 different states, so that you move and you're up against a whole new set of rules? I see some nodding and hear some yeses. So this is something that we have been working on, and also that you can find more information out about on the website. But I just want to make another point that I think there's about 140 supporters in Congress now of this bill. So one of the things that you want to do if you're going to reach out to your representative is, you can also say thank you. So how do you know, does my representative support this bill? So there is a website called congress.gov, and you can go on that and find, any legislation. You can put in, topics. If there's a particular topic you're interested in, you can put in a specific bill number. So this past March, we were in Washington, and we dropped by one of our congressman's offices, and we said thank you. Thank you for supporting the NIH. Thank you for supporting HR 460. We didn't get to meet with him directly. We met with his staff person, and his staff person just kind of looked at us and said, people don't usually drop by to say thank you. And a couple days later, a letter from that congressman, sorry I missed your visit, and rest assured I'm working on these issues. So, a little thank you can go a long way and make an impact. So that's why I'm telling you about congress.gov. You type in HR 460, and you get the whole bill, and okay, and then there's a section here, 140 co-sponsors. So you can look and see if your representative is co-sponsoring the bill, and you can go, through our website. There's sort of a standardized email that can be sent off, but you also have the place to edit it, and you can edit it to say thank you for supporting this. It's very important to me. And again, I think a little thank you can go a long way. 460? So some things take a while and require a lot of patience, and this is an example of something that happened very quickly, and it was the stakeholders' voice that made a difference. So the Centers for Medicare and Medicaid, or CMS, were proposing a rule to eliminate some protected drug classes in Medicare Part D. So it can get kind of complicated, and I don't really want to get into a lot of the details, but one of the protected drug classes was immunosuppressants, which is a category of drugs that's very important for patients with lupus. So CMS had a comment period, which for a lot of federal regulation, for rule changes, there's an open period for which people can comment. This got so much attention. Over 7,000 letters were submitted. And the LRI signed on to a group letter. And there was such an outpouring of concern about what this meant for Medicare beneficiaries that they didn't move forward. And a letter from the then head of CMS stated, "Given the complexities of these issues and stakeholder input, we do not plan to finalize these proposals at this time. We will engage further stakeholder input before advancing some or all of these changes in these areas in future years." So your voice was heard, loud, and clear. So sometimes things happen fast. Sometimes they take a long time. But success stories like these, I think, help to keep us going. So, what can you do? So there are, a lot of different ways to be an advocate. And as I said earlier, you can do whatever you're comfortable with. And, when you get past that first time making the phone call or visiting with your legislator, you think, they're just regular people. And, wow, they, really seemed interested in what I had to say. And getting over that first hurdle, I think is very important. So you can, help call for increased funding of lupus. You can generate awareness of lupus. I mean, many of us, you all know very well that a lot of people say, what is lupus? So helping to generate awareness is also helping, to advocate so that people know what it is. You can, support initiatives like we've talked about just a few of them today. You can share your story. So there's many things that you can do. And so people like me who are a, professional staff person, I can go in with numbers and statistics, but if I go in with a patient, they don't want to talk to me. And I've been in offices with some of you that are here, and, and I think you've seen that firsthand. They want to hear your story. You're the constituent, and it's very important that your voice be heard. So a few resources that we have. So last year we did a few webinars on advocacy. We have a toolkit, the Legislative Action Center, which we talked about. So these are things that you can find on our website to learn more. And I had done a few small group training sessions, and I'm doing another one on November 4th if anybody's interested in learning a little bit more. And I have my notes here so that I wouldn't miss anything, and I know I missed something. So I was on a webinar not that long ago, and it was about advocacy, and the person who was running it said that he had once talked to a legislator who said, you can give me a petition with thousands of names on it, but if I get 15 phone calls, I'm going to pay attention. 15 phone calls, it's not that many. You, your friends, your neighbors, we can do this. We can do it collaboratively. we can do it together. We work nationally with our national coalition members. So if you've got friends or relatives across the country, and we have some representatives from some of these other groups that are here today. So that's a way to get people involved nationally. So, you know, wouldn't it be nice if no health insurance customer service rep ever heard those words, "You are the object of my frustration," again? I would love to save everybody from that. But, you know, it was those words that did actually help propel me to go to graduate school and study health policy and want to make change. Wouldn't it be nice if we could stop all the trash from flowing down the river and stopping it all upstream and nobody had to wade in and pull it out? So next year, when we're back here again at this research and advocacy meeting, and whoever speaks on advocacy, maybe it'll be one of you, you'll have some great story to tell. Wouldn't it be nice if when I say who here has done healthcare advocacy, everybody raises their hand? It takes a village. It takes us all. So there's my contact information. So you can always contact me with questions, comments, ideas for the upcoming training. And I would like to, you know, leave some time so we can hear about some people's that might want to share their stories and ask questions. But I also want to make a point of, again, thanking our sponsors, GSK and Mallinckrodt Pharmaceuticals, for this whole meeting this afternoon. I'm going to open for questions and comments and maybe a little discussion.
Thank you, Diane, for being so available and always providing information for us to help ourselves in a more positive way. And I never thought about the theory of going upstream to stop the problem from being a problem downstream. That is real potent in my head. And I really, just for that alone, I want to say thank you.
Thank you. Does anybody have an experience, you know, something that they did to advocate for something that they would want to share? Anything?
I was happy to see a lot of your literature uptown in East Harlem at a neighborhood-based group. I think it's called the East Harlem Asthma Center for Excellence. But I noticed that they're sort of letting themselves become a clearinghouse for all different healthcare stuff. And something else that we probably could all do on a neighborhood level, I have not, well, anyway, so every community board has these committees, and I think every community board probably has a health care committee. So, yeah, and I happened to notice that the healthcare committee meeting was actually borrowing a room from this neighborhood center. You know, everybody's always looking for a meeting spot, right? And so if we can keep our antenna up for these kinds of neighborhood-based things, even if they're small, it's a lot of voices all around the city starting to use these committees to our best advantage.
Yeah, and you know, if you hear of, you know, committee meetings or things that you would like us to come out to and speak, you know, please, you know, reach out to us and let us know. You know, we try and be out in the community as much as possible. I mean, and I know, you know, every time somebody says, you know, to you, what is lupus, that it's very hard. But there are, what, 7,000 plus diagnosable diseases out there. 500 have cures. So, you know, expecting everybody to know what lupus is, and sometimes I've said to people, before you were diagnosed, did you know what it was? No, but I hope that at least now there are good, solid resources out there to be able to share the information of what it is, and hopefully there'll be a day when people don't have to ask you what it is, because we'll...
At the beginning of your presentation, you had mentioned that you had workshops for doctors. And in my case, well, and especially since I was young at that point, the primary doctor I always made sure I saw was my OBGYN. And at the point of my diagnosis, I was amazed how completely oblivious, he was. Have you ever thought of targeting OBGYN specifically, especially since it's a disease that hits women so
So,
hard?
with this latest round of funding that the American College of Rheumatology has to disseminate all the work and curriculum that they've developed over the years, LRI actually has one of the projects, and we are going to be targeting physicians who are most likely to see women who are at risk for lupus. So, and men as well, so I don't want to offend any of the men in the audience. But since you said OBGYNs, yes, that is a group that needs to be targeted, since a lot of people do see their OBGYN as their primary. But emergency room docs, as well, because often, by the time people are diagnosed, they're showing up in the ER, in kidney failure. And primary care docs who are out in the community practicing in neighborhoods where, we would expect a higher prevalence of lupus. So we are going to do as much as we can within the resources we have, to educate and target. So, Steve?
That just brought up a thought I had. These walk-in clinics, they're another place where the doctors should know how to deal with this, with lupus.
Yeah, that's a good idea. So, all right, we have one more.
We have another back here.
Hi. Hi, Diane.
Oh, sorry.
How are you? My name's Ken, and I'm here with my wife, Janine. We got here a little late. But I think, some people are talking about people not knowing about lupus. And my wife was diagnosed 6 months after we got married. And after she got diagnosed, I'm riding on the train to the city, and I'm thinking to myself, how come, I've never heard of this, and nothing's being done about it. But I think until something affects you, or a family member affects you, it's only natural not to be aware of it.
Yeah.
So all of us in this room are aware of it. So we need to do our part to get the word out. And Diane was talking about advocacy. My wife, myself, my 3 kids went to DC last year, and we went to the offices of a local congressman, and we sat there with them. We spoke to their aides, and like has been said in the room, if you go and sit in front of them and tell your story, they cannot say that you were not there and they didn't hear. So because of what we did last year, I know that changes have been made. So I know with the situation that all of you are in, it's tough to get up and do things sometimes, but even little things make a big difference. We ran, we're from the island, and last year we ran a race in May. It was the first 5K for lupus. We ran it in Central Islip, and it's been a dream of mine since I can remember. But a lot of people showed up, and they were asking, what is it? So you can have a chance to explain it to them. Other people were there, and they have a story to tell. So, and that can also include calling a news program.
So I'm glad you guys are back there, because I didn't see you come in and realize you were back there. So can I embarrass you a little bit? So, Ken and Janine not only do what he said, but they also were in Albany in May with their daughter. So they're teaching their kids how to advocate and why it's so important. And they are very active with the Lupus Alliance of Long Island Queens on the board and volunteer. So they are really, saw a need and have gotten out there and are doing a lot to really help spread the word. So thank you for your comments, because, I think it's very important for people to hear from each other. So with that, All right, so Amy's our
yeah.
newest staff member, and she's actually going to be leading the project with the American College of Rheumatology, so she's like busting a gut to say something.
I am, only because, I mean, there's such a theme here, and I wanted to introduce myself because I've spoken with some of you and know some of you, so it's good to see some faces, and, you know, we have a dedicated resource to this because, you know, getting the provider community to know more about this and to help early diagnosis is huge. I mean, full disclosure, I have lupus. I was diagnosed by a primary care provider, and I mean, without that diagnosis from the primary care provider, I would have never made it to a rheumatologist. It took a long while to get there, but we got there. So I just am telling all of you how dedicated I will be over the course of this project to make sure that happens. And as far as what you guys can continue to do, I mean, I know we've been echoing it. Whether or not you can be in person at these events, write a letter, just try to be as involved as you can in these foundation events, because really when you get in front of a doctor, whether primary care doctor, a nurse, whatever, again, echoing what Diane had said, if you put a patient face that says, I have lupus, does it look like it? Maybe it does, maybe it doesn't, but you wouldn't guess it with me, that's for sure. And it's really, really, really powerful, whether it be you're educating a provider or you're down in DC talking to a legislator. It is absolutely powerful. So just really, whenever you can participate, get your case heard, and it really does make a difference. So I certainly look forward to seeing all of you at our events and you know, keeping you guys abreast of what we're doing. So thank you so much for coming and for your continued input.